Hello, everyone. Welcome to episode 46 of Lump Basics, or the Lump, TCM, and Acupuncture. Let's talk about yang deficiency. Okay, with yang deficiency, this does not cause a stagnation situation directly. Yang deficiency causes cold symptoms in an organ or in an area of the body. Because of the deficient yang, it may cause a slow retardation of the organ function, which in turn would lead to stagnation of blood or fluid. Yang deficiency as a symptom, because it led to stagnation of fluid or blood, will manifest in pains and stiffness in the muscle or joints that are aggravated in cold weather and at rest, and improve in warm weather and with activity. So for treatment, we do moxibustion on the front mu and back shu points of the affected organ. We also do tonification point or C point. This is the point at the knee or elbow of the yang organ of the coupled organs. We also use the grandmother point of the yin organ. Advise eating bitter foods and drinking bitter teas. Advise eating red meat and fish because you want to increase the yang. Cooked and warm. Advise using bright colors. So you may have to change the color of your walls. Okay. Now let's talk about yin deficiency. Yin deficiency in an organ will cause dryness. And this leads to heat that is uncontrolled and flares upwards. Okay, let's look at the symptoms. So, like dryness and hardness. So we need to, and there's also tension and cannot loosen up or relax. There is restlessness and a hot feeling, insomnia, night sweating, hot flashes, nightmares, burning eyes, and recurrent yang excess symptoms like migraine and tendonitis. Treatment, we need to try to irrigate and to cool and drink lots of water and eat watery foods, pre-soak the foods, and then cook in water. So we are looking at foods that are being cooked in water. Tonify the kidney yin and the yin of the organ by using the mu front point, the luo point of the yin organ, because if you needle the luo point of the yin organ, it actually impacts the coupled yang organ of the yin. And we use the house element point of the yin organ and the grandmother point of the yang organ. Use dark, deep colors and water features. Swimming is highly recommended. Seafood, preferably not red fish, is good as it has water energy. Adding salt to food in moderation will help to retain more water. Some raw foods and salads, not in the evenings, will reduce body heat. So we're not supposed to eat raw food and salads in the evenings. A short midday rest is rejuvenating as it is the lowest energy time for the patient in a yin deficiency state. Thank you very much for your attention. Up next is Ma'am Lynn Galarita for our second topic, pulse qualities. Good afternoon, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. So now let's discuss about pulse qualities. What comprises pulse qualities? When we talk about pulse qualities, we mean first, speed and rhythm, second, fullness, third, level of depth, fourth, tension, and fifth is width or breadth. So what is speed and rhythm? We determine whether the pulse is slow or rapid, and whether the pulse has regular rhythm or irregular rhythm. Uh, Normal speed of our pulse is 4 beats for our respiratory cycle. But if our pulse rate hastens, so does our breathing. So it would always be 4 beats per breathing cycle. Therefore, it is necessary to take the patient's pulse rate according to the therapist's breathing as a guideline. Or, since we now have the clock, we could use the minute as a guide. Normal pulse is 72 beats per minute. Generally, young children have a slightly faster rate than those over middle age, which is slower. So what is a slow pulse? This is 60 beats per minute or less and shows cold or yin dominant state. Could also show a heart yang and qi deficiency. We often find that athletes and those who do regular training have a slower pulse rate. It is considered to be a sign of a well-trained heart. Exercise is good when done in moderation. When it is done to an extreme point, it can injure the heart function, causing a qi deficiency of the heart. Many sportsmen and women come to the doctor and complain that they have no energy, cannot concentrate, and feel sleepy and dull all the time. They only feel better after they do their training and when the heart rate increased. At all times, they have low energy. So, slow pulse does mean heart yang and qi deficiency in every case. Now for the rapid pulse. This is 80 beats per minute or more. This is caused by heat or yang dominant state in an organ. It could also be heart yang excess or yin deficiency. Now we'll go to the rhythm. What is regular arrhythmia? This is a heart qi deficiency symptom. There are extra systoles appearing at regular and predictable intervals. It is more common when patient is at rest and tends to disappear in activity or if doing physical exercise regularly. And now for irregular arrhythmia. This is more serious and shows a yin and yang deficiency of the heart. This may occur at any time, but mostly during exertion. So in fullness, there is an excess pulse. There could also be a deficient pulse. Having felt the radial artery, you should press it slowly all the way down and then release the pressure. Normally, when you press down halfway, the pulse feels more resistant, but is weakened under heavy pressure. This shows the fullness of blood and fluid within the artery. That's the blood and yin. So for excess pulse, this shows excess yin or blood and fluid. The pulse becomes more resistant with pressure even at the deeper level. And for a deficient pulse, which is also called a hollow or empty pulse becomes weaker even at light pressure. This shows a deficiency of blood and yin. That's all for now. Thank you for your attention.
Thank you very much, Ma'am Lynn. Okay, let's talk about hot or cold. Different organs govern the temperature for different parts of the body. The heart is the central circulating organ for blood, so the heart governs the general body temperature. The organs of the lower warmer, the kidney and urinary bladder, they govern the temperature of the back, legs, and feet. The spleen, which regulates blood in the periphery, maintains the temperature of for the hands and feet and the face. We should ask a patient if he feels easily hot or cold in their body. If they answer yes, then the next question would be, where do you feel the heat or cold sensation? Yang dominant states in energy produce heat sensation, and yin dominant states manifest cold. They could answer they do not feel hot or cold easily, only in extreme weather. This is pretty much normal. Some others could answer yes to both. They feel both hot and cold easily. How is that possible? Well, when I am active, the patient would say, I feel very hot and peel off my clothes. When passive, I feel very cold. What climate do you like then? I like it not hot, not cold, just moderate. This shows a chronic yin and yang deficiency, where neither can control the other. So, in a yang dominant or active state, the yang rises to produce heat, and in a yin dominant or passive state, the yin rises to produce cold. Okay, let's talk about a patient who feels hot all over. So we have the acute state, which could be from exterior invasion of wind heat. Okay. So here you could see that an example where a patient has interior heat because it has now affected the heart or triple warmer. So you could see the tower diagram there. So the interior heat is quite recent. Okay, as you could see, there is still an uncontrolled yang. So that means the yin is not enough to be able to control the yang. So this is where one would manifest interior heat, which is affecting the heart or triple warmer. So for the subacute or chronic state, as you can see, we again, this is a very different tower diagram compared to the first one. Okay, so here you could see the yang is in excess while the yin is very deficient, or the yang is relatively higher or more, although it is normal within normal limits, but because the yin is deficient, so the yang is apparently relatively higher. Or you have a very uncontrolled yang because the yin is very deficient. Okay, so this is either subacute or chronic state. Okay, so if you have hot hands, thorax, and head, so is heart involvement. It's the heart. So if you have hot feet, not to be confused with burning feet, it's the kidney. So here you have a situation, okay, by looking at the tower diagram in which the kidney yang is very predominant, okay, or you may have both kidney yang deficiency, the kidney yang excess, and a kidney yin deficiency. Or there is kidney yin deficiency because it is unable to control the yang. Okay, that's why we have hot feet. Or you can have hot hands, feet, and face. This is damp heat in the spleen. So let's analyze the tower diagram. This is where you could see too much dampness. Okay. and the yin is within normal, but the yang, okay, so this is damp heat, so you would expect both the yang and the and the yin, or the dampness, to be high because of damp combination with heat. So you'll have hot hands, feet, and face. Okay. So treatment for exterior heat invasion, we sedate the Shi cleft point, heart 6, Li11 to improve the immune system, sedate Si8, the sedation point, and tonify the water using kidney 7. For heart yang axis, we do sedation of Si8, and we needle Ren 14, which is the front mu point. Okay, for hyperactive heart yang, we use the luo connecting point of the heart, so that means it can impact the yang partner of the heart. Okay, heart 5. And we do have to sedate Si4, which is the yuan source point of the small intestine. Heart yin deficiency, we needle Ren 14 and the house element point, which is heart 8. For kidney yang axis, we have bladder 65, sedation. Okay, if you remember, bladder 65 is supposed to be the sedation point of the urinary bladder. So this is an example in which, instead of really focusing on the kidney yang, we focus on the yang partner of the kidney, which is the bladder instead. So, and also we need to do heat dispersing technique for kidney 3, which is the yuan source point of the kidney. Then for kidney hyperactive yang, we do we use the kidney 4, the luo connecting point, so that it can impact the bladder, which is the partner of the kidney. And of course, we do sedation of the yuan source point, bladder 64. For damp heat in the spleen, we do heat dispersing technique for spleen 9, and also the Bach shoe point, bladder 20, and the luo connecting point, which is stomach 40. Then finally, we have the triple warm yang axis. We do sedation of triple warmer 10, sedation point. Thank you very much for listening. Sir Dino, are you ready for topic number 4? Good afternoon, Sir Dino.
Good afternoon, Doc.
Okay, thank you very much. Okay, let's welcome Sir Dino Pinheiro of Legazpi for topic number 4, which is the earth element.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with the topic, spleen, stomach. Here we have the sense of taste for the spleen, the blood deficiency and Qi deficiency. There is a poor sense of taste, craves sweets, and carbohydrates. Sa spleen, nourishing muscles and fat, the person is thin, small muscles, and atrophy. Yung emotion, worry. There is obsessive compulsive worry. Yung color, yellow. Likes all shades. All shades are good. Red and pinks, good. Sa climate, yung sa dampness, there is edema in the hands, feet, and eyelids. Yung sa spleen deficiency, ang tower diagram, parehas po mababa yung blood and Qi. Sa sense of taste, there is poor sense of taste, like strong flavors, crave sweet, and carbohydrates. Smaller ang muscles on arms and legs. And sa emotion, passive warrior, eats when worried. Yung color, likes pastel and bright shades there are good, red, and pinks. Tapos good. Sa climate, edema in extremities and eyes. Next, our diagram sa spleen, damp, cold in spleen. Excess po yung blood, deficient yung chi. Sa sense of taste, there is poor taste, like sweet and carbohydrates and strong flavors. Meron siyang large muscles, not necessarily strong. Sa emotion, passive warrior, tapos lazy. Yung color dislikes mustard, brown, light beige, yellow is good, pinks, good. Sa climate, edema in arms, legs, and face. Next, tower diagram, we have the spleen. Damp heat in the spleen. Excess po yung blood and yang, and deficient yung chi. Sa sense of taste, dislike sweet, sticky, sweet taste in mouth, strong flavors, and pain. Sa emotion, can be either depending on yin or yang dominant, generally active, worrying. Sa color, dislikes all shades, white is good. Sa climate, same as damp, cold. Next, tower diagram sa stomach, empty, dry stomach. Normal ang yang, deficient yung yin. Sa sense, like creamy, sweet taste, very well. Very particular with food. Spleen naman, meron siyang small muscles, thin atrophy. Sa emotion, active warrior, cannot eat when worried, loses weight. Sa color, like mustard, deep brown, or yellow-green, good. Next, tower diagram, yung stomach fire. Excess yung yang, deficient yung yin. Sa sense of taste, like creamy, sweet, very sensitive taste, like simple food. Sa emotion, stomach pain, worried, more when pain, dislike orange and bright yellow, deep green, white, good. Sa last tower diagram, yung sa stomach, cold stomach, excess yung yin, deficient yung yang. Sa sense of taste, sweet and cream make pain worse, poor sense of taste. Small muscles on the arms and legs. Sa emotion, constant passive warrior, never satisfied. Sa color, likes light beige and yellow, pink and red, good. Sa climate, there is edema in the hands, feet, and eyelids. Okay, thank you for listening.
Thank you very much, Sir Dino. Let's now call on Ma'am Lynn Galarita for topic number 5. She will continue her discussion of the therapeutic methods.
Good afternoon once again. Now we're on our last topic on the therapeutic method, the 6th method, which is descending. So before that, a quick rundown of the first 5. We have the reinforcing, reducing, warming, clearing, and ascending. So for today, we will talk about descending. So what is the descending method? This is to make the upward perverted chi go down and to subdue the yang. So in other words, upward perverted flow of chi should be checked by descending method. For example, we need a stomach 36 to make the perverted chi of stomach descend. So for regulation of stomach by keeping its perverted chi to descend, we use points CV17, CV12, pericardium 6, and stomach 36, which we needle with even movement. So what is a rebellious chi or perverted chi? The symptoms of rebellious qi have to be distinguished according to the organ involved. Rebellious qi occurs when qi flows in the wrong direction, that is, a direction different than its normal physiological one. This varies from organ to organ as each has its own normal direction or flow of qi. So for the first point that we use, CV17. It is a very important point to tonify qi. Moxibustion on this point is often used to stop smoking. So where is CV17? It is between the nipples, level with the fourth intercostal space on the anterior midline. We needle with transverse insertion pointed upward or towards the breast, 0.5 tune to 1.5 tune. We expect a sensation of local distension, soreness, or a deep, heavy feeling in the front of the chest. Next point is CV12. This is the front midpoint of the stomach. It's equally applicable for excess and deficiency. It is located on the anterior midline, fourth tune above the umbilicus. Needling is done perpendicular, 0.8 to 1.5 tune. Caution is observed in this point in thin patients as deep needling may penetrate the peritoneal cavity. Next point is pericardium 6. This is a major point for stomach, heart, and shen. This is also a major point to suppress nausea, stop vomiting, and relieve epigastric pain. PC6 is located 2 tune above the transverse crease of the wrist between the tendons of the palmaris longus muscle and the flexor carpi radialis muscle. We puncture this point perpendicularly, 0.5 to 0.8 tune. Caution should also be observed as the median nerve lies directly beneath this point, and needling it commonly induces a significant electric sensation. This is an acceptable manifestation of the qi or the arrival of qi, but once elicited, further manipulation is inappropriate and may damage the nerve. Next point is the very popular point, stomach 36, ZUSANLI. It has a direct effect on the stomach. Located below the knee, 3 tune inferior to stomach 35, 1 finger breadth lateral to anterior crest of the tibia. You could also locate this through locating first GB34. Stomach 36 lies 1 tune inferior and 1 finger breadth lateral to the anterior crest of the tibia. Or we can just locate this measuring 1 hand breadth below stomach 35. Needling is done perpendicular, 1 to 1.5 tune. Next use for the descending method is for soothing liver and subduing liver yang. We use the points GB20, liver 3, and kidney 1, needled with reducing method. So what is liver yang rising? The clinical manifestations for this are headache, which may be on the temples, eyes, or lateral side of the head, dizziness, tinnitus, deafness, dry mouth and throat, insomnia, irritability, feeling worked up, shouting in anger. The tongue will be red, especially on the sides, though may vary with underlying condition. The pulse will be wiry. Key symptoms for liver yang rising are headache, irritability, and a wiry pulse. So for the points we use, number 1 is GB20. It is the single most important point for headaches and dizziness, no matter what etiology or channels are involved. GB20 is also the major point for wind. It is located below the occiput, midway between DU16 and GB12, in the hollow between the sternocleidomastoid and trapezius muscles. We locate this point close to the base of the skull. This point is normally located at the most tender point of the hollow. Needling is done slight obliquely inferior in the direction of the channel, 1 to 1.5 June. We can also do this with needling directed toward the tip of the nose, contralateral to the eyeball, or yintang, 0.5 to 1 June. Caution is also observed here with deeper needling may damage the spinal cord. Next point is liver 3. Liver 3 comprises 2 of the 4 gates, the other 2 being LI4. This point is a total relaxation point. It is located on the dorsum of the foot and the hollow distal to the junction of the first and second metatarsal bones. We puncture this in the direction of kidney 1, 0.5 to 1.5 June. Next point is kidney 1. This tonifies yin and reduces empty fire. We can massage kidney 1 before bed to treat insomnia. It is located on the sole of the foot in the depression when the foot is in plantar flexion, approximately at the junction of the anterior 1/3 and posterior 2/3 of the line connecting the base of the second and third toes and heel. Needling here is done perpendicular insertion, 0.5 June. In general, descending method cannot be used for deficiency syndromes or deficiency syndromes in upper part and excess in lower part of the body. This caps our discussion on the therapeutic method. Thank you for listening.
Thank you very much, Ma'am Lynn. We now move on to topic number 6. Let's welcome certified acupuncturist, Ma'am Nitsu, for the controlling cycle. Good afternoon, Ma'am Nits.
Good afternoon, Doc Hector. Good afternoon, everyone. Topic for today, controlling cycle. Sedation on the controlling cycle. Let us now take a look at the last 5-element connection. Just as each meridian has a tonification point and a sedation point on the mother-son cycle, each meridian also has a tonification point and a sedation point on the controlling cycle. The difference is that the tonification point on the mother-son cycle tonifies more of the house energy, whereas the tonification point on the controlling cycle tonifies the opposite polarity of the meridian. Okay, the similarity is that the sedation points in both cases sedate mainly the house energy of the meridian. So let's analyze the graph, okay, the drawing. Okay, so in the figure, one can see that the gallbladder has 2 directions of energy flow. Number 1 to the small intestine and the triple warmer, that is the sun-yang organs. Number 2 to the spleen, the grand sun yin organ. So if you wish to sedate the yang of the gallbladder, you could. Number 1, sedate gallbladder 38, which is the sun point or the fire point. Or sedate gallbladder 34, the grand sun point or the earth point, okay? Both points would sedate gallbladder yang. And as far as the gallbladder is concerned, it would not make a difference. but different organs will receive this energy from gallbladder. And whichever organ this energy flows to, it will increase the yang in that organ. Remember, it would also make better sense to send this excess yang from the gallbladder to one of these organs with a greater deficiency in yang. These are very useful points to send energy around from one meridian to any other meridian as is necessary. So if the patient needs gallbladder yang to be sedated in order to treat recurrent migraine headaches, for example, then it would be important to send this excess energy away to an organ that is deficient in yang, not to an organ that already has enough, okay? So therefore, we should pause before we decide which point we should sedate for the treatment to be successful, okay? If this patient has sleep problems, for example, is restless at night and hyperactive during the day, he has a yang dominant state in the heart. Sedating the 5 point of gallbladder would send more yang to the small intestine of the heart. The energy will not settle there but shuttle back and forth. But if this patient has no heat symptoms in the stomach and spleen, it would be better to sedate the earth point on the gallbladder, sending the yang into the spleen, okay? Or, as in the above figure, the spleen sends its dampness away into directions to the lung to nourish and make the skin and respiratory system damp, and downwards to the urinary bladder. When we need to sedate the dampness of the spleen, we can, okay? Number 1, sedate spleen 5, the metal point, or sedate spleen 9, the water point. Spleen 9 is called lay 6 point because it causes diuresis, as it sends the fluid directly to the urinary bladder to be eliminated. Okay, understand? In both cases, sedation of the spleen sedates the spleen yin, and both the lung and urinary bladder receive yin from the spleen. Remember, okay? So, yan po. Let's go to the next box, 6.13, additional points to sedate yang or yang of yang organs on controlling cycle. So you can screenshot. Sedate small intestine 1, which is the metal point for the lungs. Sedate triple warmer 1, metal point to the lungs, for the lungs. Sedate stomach 44, which is the water point for kidney. Sedate Li3 or wood point for the liver. Sedate UB60, 5 point for the heart and pericardium, and sedate gallbladder 34, which is the earth point for the spleen, okay? In this box 6.14, additional points to sedate the yin of the yin organs naman. Sedate heart 4, which is the metal point for large intestine. Sedate pericardium 4, which is metal point for large intestine pa rin. Sedate spleen 9, water point for urinary bladder. Sedate lung 11, which is wood point for gallbladder. Sedate kidney 2, which is 5 point for small intestine or triple warmer. And sedate liver 3, which is earth point for the stomach. Okay, screenshot na lang po natin para ma-remember. Thank you for your attention, everyone.
Thank you very much, Ma'am Needs, for the very wonderful or mind-boggling controlling cycle. Maraming salamat po. We now proceed to meridian theory. This time we call once again Ma'am Lynn Galarita of Quezon City.
Good
Hello.
afternoon ulit.
Good afternoon.
We're on our fourth part in our discussion on the gallbladder meridian of the foot, lesser yang. We left off last time with GB 38. So now let's start with our studies on locating the gallbladder meridian points with GB 39. GB 39 is 3 tune proximal to the highest prominence of the lateral malleolus on the posterior border of the fibula. For the point explanation, the after 45 point, this is the after 45 point. This is the influential point for the marrow both nerve marrow and bone marrow. As early aging causes lessening of bone and nerve cells, it is good prevention to take this point every week after the age of 45. This could also be used for blood deficiency as bone marrow makes blood. Next point is GB40. It is located in the depression anterior and inferior to the lateral malleolus, lateral to the tendons of the extensor digitorum longus muscle. This is the Yuan source point of the meridian. It can be used in sedation to sedate the yang of the gallbladder and in conjunction with the loop connecting point of the coupled meridian, which is liver 5. Next point is GB41. It is located in the depression at the junction of the shafts and the bases of the fourth and fifth metatarsal bones, lateral to the tendon of the extensor digitorum longus muscle. This is the wood point and the house element point of the gallbladder, and this point can be used in tonification or sedation for young. It is also a meridian distal point of the meridian. This is the exit point of the gallbladder meridian where it flows into the liver meridian at liver 1. Next point is GB40. It is located between the fourth and fifth toes, proximal to the margin of the interdigital web. This point is the tonification point and a wind eliminating point. It tonifies more the yang and less the yin. For the last point, GB44. On the fourth toe, point 1 tune from the lateral corner of the nail. This is the last point, and it's also the metal point of the channel. This is used to tonify the yin of the gallbladder, as it is also the grandmother point. So this is all for now. Let's continue discussing the gallbladder meridian tomorrow. Thank you.
Thank you very much, Ma'am Lynn. We now come to the last topic for the day. We are still on chronic fatigue syndrome, the Western medicine concept. The research into CFS, or chronic fatigue syndrome, has brought up new thinking into chronic viral infections. So according to Barrow, Oldstone, and De La Torre, these observations indicate a new way for viruses to do harm. They act subtly on a cell and disorder its function, but not severe enough to kill the cell they infect. Yet for the host, the end result is disturbed homeostasis and disease. Mowbray and Youssef found that CFS patients display a new pathology in dealing with viruses. These patients recognize the virus and respond to it, but without eliminating it for extended periods. From the Chinese perspective, this inability of the patient to rid himself of the virus is due to a deficiency of the body's qi. It has been a view of many doctors that chronic fatigue syndrome is all in the mind, and it's nothing other than a form of depression. While this dichotomy between body and mind is typical of some practitioners of Western medicine, new discoveries in immunology have uncovered the role of psychic and emotional factors in immunology. So this brings a unity of body and mind, similar to that of Chinese medicine. So according to Woods and Goldberg, it is evident that depressed immune function increases susceptibility to certain viral illnesses. Woods and Goldberg also express very well the conundrum generated by the body-mind dichotomy. David presents 4 models of interaction between body and mind in the pathology of CFS. So in the first model, we have a physical insult causing a physical disability, and this affects the mind. So let's take a look at it. Okay. So we have here the the ability of the physical insult to actually affect the mind. Okay, so physical insult causes disability, and this causes, of course, psychological disturbance. So this is something worth remembering. In the second model, a physical insult causes both psychological disturbance and physical disability. So we go to the second model. Okay, I think that's very easy to understand. Okay, unlike the first model in which it is the disability that leads to a psychological disturbance, but the second model shows how physical insult can cause both psychological disturbance and disability simultaneously. And the third model, physical insult causes a psychological disturbance, and this causes a physical disability. So we really see the connection between the mind and the body. So the third model is so easy because here you could see the physical insult first affecting the leading to psychological disturbance, and which later on would lead to a physical disability. And finally, the fourth model, there is an interaction among the virus or the external insult, depression, and fatigue in a closed circle without being able to identify what is primary. So this last model is the one that's very close to the TCM concept of the body and mind. Okay, let's take a look at it. Chan. So as you can see, it's actually a closed circle. Okay, and we cannot determine what is the origin or the primary cause. Okay. Yan. Wallace gives the following as the essential clinical manifestations to diagnose CFS. First is fatigue. Then fatigue is severe, disabling, and affects physical and mental functioning. And number three, the symptom of fatigue should have been present for a minimum of 6 months, during which time it was present for at least 30% of the time. Other symptoms may be present, particularly myalgia, mood, and sleep disturbance. And most of these patients, they just take vitamins or nutritional supplements without realizing how important it is to actually cause a balance of the body, the mind, and the spirit. Thank you very much for listening. Hope you can join us again in our next presentation. Thank you very much.